A very good evening, everyone. Welcome to our third session, dinner session. I hope you guys are all ready. So, in today's session, we'll continue with the same format of MCQs discussion, where we'll try to highlight certain key points from various subjects, especially clinical subjects. And in coming days, we'll try to extend our discussion towards basic subjects as well. So, compared to previous dinner sessions, we started including basic questions as well. So, as we move on, we'll shift our focus towards basic subjects too. So, I hope you all had a fantastic day today. So, some of you might have started your day very early. Waking up early in the morning is definitely no solution for all the problems, but it's definitely the best starting point. So, how was your day so far? I hope it is streaming fine. If any issues with streaming, do let me know. We'll see if we can adjust to enhance the quality. It can be either video or audio. So in today's MCQs discussion, we'll have the following topics. So I hope you guys are all ready. And before we start, I want you to keep the following things in mind. As I keep on reminding, so consider this very, very important. So first and foremost, always keep three things in mind whenever you're attending these live classes, live sessions. So whichever topic or concept you come across, assume that it's going to be coming in the final exam. So that gives you that sense of seriousness and you'll not take things for granted. And secondly, make notes, customized notes, right? It can be keywords, key points, as per your convenience, so that you can revise the same at a later date, especially before the exam during your final revision phase. And third, enjoy the process. Make sure that you're enjoying what you're doing because learning as such is fun. And as I said, as I mentioned in last dinner session, if learning is imposed, it appears like a punishment. Unfortunately, that's how it's perceived in majority of instances, at least in our country. But learning, if not imposed, is always fun because we learn things. It's enlightening and it's a new experience. Our perspectives will start broadening, and we get. And being a clinician, being a dentist, we get this wonderful, amazing opportunity to apply all that we learn on patients. So there is some practical orientation also. So theory and practical, there is a connect between the two. So as I said, learning is definitely fun if it is not imposed, right? So with this introductory comments, let's go ahead with our MCQs discussion. I hope you guys are all ready. Yeah. Yes. So first and foremost, these are about batches, which most of you are already familiar with those who are attending these live sessions. So you can check out details of our crash course and regular batch for 2022 and 2023 MDS entrance exams respectively. So a 5 a.m. club. So this is something which I'm intentionally keeping this slide just to remind you all that even though starting your day early is no solution for all the problems you have or we have in our daily life, but at least it's definitely a best starting point, right? So wake up early, experience the difference, and make sure that and see to that you're allotting that quality 3 to 4 hours of time towards your priorities or to meet your challenges accordingly. Consider that a very, very important. Start your day early. So we'll start with the first question. I hope you guys are ready. So here we go. Which of the following is a feature of periodontal abscess? So, first of all, distinguishing features between periapical and periodontal abscess are very, very important. So, when it comes to vitality of tooth, when it comes to radiographic changes, when it comes to clinical manifestations, right, signs, symptoms. So, the distinguishing features are very important, not just theoretically, but as I mentioned previously, in a clinical perspective, you should be able to identify, differentiate, and diagnose so that you can institute treatment accordingly. So, which of the following is a feature of periodontal abscess? And you have the following options. Option A, associated tooth is usually vital, the tooth associated with periodontal abscess. The associated tooth, option B, is usually mobile. Option C, a pain on lateral movements. Is it so? And option D, loss of alveolar crest on X-ray, that is on a radiograph. Periapical radiograph, bite wing, usually we go with IOPA, periapical radiograph. So which one do you think, which of the following options do you think is a feature of periodontal abscess? Yeah. So if it's not clear, you can do one thing. You can try increasing uh, the quality of your video. See, you can just check out the settings option in the YouTube player, and when you click that settings option, you have option of quality, and there you can try playing it in highest quality possible. Uh, 1080p HD quality is not available, but 720p. You can definitely go through the letters which are being displayed here, right? For that, you need to have better internet connection. So you can check out that option, Ritu. And even if it is not clear, don't worry because I'm reading the question for you. So which one do you think is more appropriate answer? So associated tooth is usually vital. What do you think about that? See, in case of periapical abscess, periapical abscess usually is seen as a sequelae of endodontic infection. So in majority of the cases, or in almost all cases, in case of periapical abscess, the tooth is non-vital. But in case of periodontal abscess, see, it's the issue with periodontium. So tooth might remain vital in majority of the cases, even though there can be non-vital teeth. So we can go with option A. That seems true. What about mobility? Since the supporting structures are compromised, don't you think the attachment apparatus which supports the tooth is compromised and there will be mobility? Of course, there can be mobility as well. What about pain? Tender on percussion. Usually, in case of periapical abscess, you have tenderness to vertical percussion, but in case of periodontal abscess, you have tenderness to lateral percussion or lateral movements. So even option C seems to be appropriate. What about option D? Loss of alveolar crest on X-ray. In case of periapical abscess, you have radiolucency periapical area, maybe extending into other areas, but initially in periapical area. But in case of periodontal abscess, obviously alveolar crest is lost, and then you can see radiolucency along the lateral margins of the root. So we'll have a radiograph, right? So which one do you think? So all options seem to be true. So which one do you think is more appropriate answer? So let's check out the key. Yes, option A is a right answer. Yes, option C also is right answer. Option B, option D. So it's a multiple right answer question. So all of the following options given are features of periodontal abscess. And please don't ask me, like, oh, what if you had to select one option? See, while creating this question, the intent is to provide you key points in the process. So there is something called as multiple right answer question. So among all the options, all options are more appropriate. All options more or less are features of periodontal abscess. So let's review some literature. This is a localized infection, as you know, periodontal abscess. So localized infection of pus within the tissues adjacent to periodontal pocket. It can be either due to introduction of virulent microorganisms into an existing pocket or decreased drainage potential. So we have various features distinguishing periodontal from periapical abscess. So when it comes to periapical abscess, yes, uh, the tooth is non-vital. There is tenderness to vertical percussion, may be mobile if there is, you know, a grade 3 mobility, or if there is accumulation of pus, there can be even vertical mobility. Loss of lamina dura on X-ray, which is a feature of periapical abscess. But periodontal abscess, as you can see, clear-cut radiolucency associated with root along the lateral aspect, extending periapically, and also there is loss of alveolar crest of bone. So periodontal abscess, the associated tooth is usually vital. The pain on lateral movements is seen. Usually the tooth is mobile because of compromised attachment apparatus and loss of alveolar crest on X-ray. Yes. So I hope it's clear. And those who have chosen any one of the options, do award yourself only 1 mark if you had chosen only one of the options as right answer. But Kritika, I reckon, has chosen all of the above. So Kritika, you can give yourself +4. Okay, so those who have chosen all the options +4. If you had chosen only one, you'll get only 1 mark out of 4. Right? So I hope it's clear. Now let's move on to the next question. Identify the instrument. appears like some kind of plate. So what's this instrument? Option A, occlusal plane guide. Option B, Willis bite gauge. I'm sorry, wide gauge, paint scraper, bite registration plate. So which one do you think is more appropriate answer? And I'm sure you must have used this right in your second year undergraduation. If not used, at least you might have bought it in your dental college. So they usually give it along with, yeah, along with your set of instruments when charging exuberantly. It's a plastic material. You cannot appreciate that here, but I'm giving you a hint. So which one do you think is more appropriate answer? Okay, appears like a bite plane, but let me give you a hint. It's not a bite registration plane. No, it's not. It has nothing to do with bite wing radiographs, even though it appears to be that way. But this platform you have here is for the patient to hold this particular plane, right? Edentulous patients especially. So I've given you all the hints. So which one do you think is more appropriate answer? So those who have chosen, okay, before I give you the answer, let me review some literature. So it's used with edentulous patients, right? So that's number one hint. Number two, it's used during jaw relationship stage of denture construction. So I said second year. Maybe you'll not use it, but you might have bought it. We bought it in our second year UG, but used it in clinical practice, yeah. Fourth year, third year during CD fabrication. It's used to check the incisor line orientation, whether incisor line is in horizontal plane, and also the sides are parallel to alatragus line. So here are all your hints. So which one do you think is more appropriate answer? Fox. Fox, occlusal plane guide. So those are chosen option A. Do award yourself plus 4. Fox occlusal plane guide, right? So it's used to check the incisor line, whether it's in horizontal plane, and also the sides are parallel with line joining the L of the nose and tragus of the ear, L tragus line. So this is Fox occlusal plane guide. Good. So let's move on to the next question. The option A is right answer. So do award yourself plus 4. So third question, combination of it's derived from surgery, endodontics, periodontics, let's say epicectomy or apicectomy, it can be called either way. It's indicated in which of the following situations? Option A, in case of irretrievable broken instrument in canal, root canal, in cases of root perforation, or in case of fracture in infected apical one third, not just fracture, but even infected. Option D, all of the above. Option E, none of the above. So which of the following options is more appropriate? Danish used it in CD patients. That's wonderful. So once you use it, or once you have seen someone using it, it's even much better registered in one's mind, isn't it? That's the beauty of a clinical doctor's profession, clinicians' work. Whatever you study, you apply, and whatever you apply, you're going to remember, and you're going to learn even more things, isn't it? So that's the beauty here. So epicectomy is indicated in which of the following situations? As in fact, we discussed about the same, about various specifications, surgical procedures in one of the videos. If you remember, the video titled Endodontic Microsurgery, where we discussed about the plane of resection, the amount of apical root that has to be resected according to various guidelines, and so on and so forth. So you can refer that video. It's available on YouTube as well as NEET classes. The title is Endodontic Microsurgery. So as majority of you have rightly chosen, good. Option D is right answer. Do award yourself a plus 4. So epicectomy. So we'll go through some of the indications. Impossible in cases where it is impossible to prepare and fill the apical one third of root, either because of fractured instrument or because of calcification with persisting infection in the apical area. Irretrievable broken instrument in canal, right? You try to bypass it, but it doesn't work out. Yeah, even in cases of root perforation, not just fracture and infection. See, if it is fractured, if the apical part of the root is vital, right, without any symptoms, then you can just leave it, as we discussed in one of the previous dinner sessions. But if it is fractured and infected, then you have to Apicectomy is definitely an indication. And along with that, persistent infection due to apical cyst or other lesion requiring biopsy, right? So that's another indication. And also presence of post-crown on tooth with apical pathology. Root canal is done. You're given a crown. Everything seems to be sealed coronally, but there is persistent infection. Rather than taking a risk or chance of removing the crown and then redoing a root canal, you can attempt apicectomy. That's one of the indications. Yes. Of course, in medically compromised case, see any surgery, if the patient is medically compromised, we need to take due consideration. We should obtain consent, look at the various parameters, bleeding time, clotting time, and only if it is indicated, only upon obtaining consent from the patient's physician, we can go ahead. The same holds true for any surgical procedure, minor or major. So, in this particular context, option A is right answer. Yeah, good, Arshi. I appreciate your feedback. So those who have chosen option D, award yourself +4. And penultimate question. So which of the following is not one of the three mechanisms the body uses to control the blood's acid-base balance? Acid-base balance is very important, normal pH of blood, even if there is deviation to slightest extent, you see there are so many clinical manifestations. So that window of pH balance has to be maintained, 7.35, 7.45. So there are several mechanisms which enable or make this acid-base balance possible. Which of the following is not? So we have the following options. Option A, excretion of carbon dioxide. Option B, pH buffers are found in blood. One example is albumin. Option C, excess acid is secreted by kidneys. Option D, filtering blood by spleen. I mean, option C, I'm very much familiar with because we have one situation, a family. Since my mother's kidneys have failed, she is on dialysis. Before dialysis, because her kidneys were failing, there was so much acidity, right? Physiologically, right? So they tried to give bicarbonates. Even now, she is on bicarbonates. So any organ, if there is compromise, right, it's going to affect the entire body. It's not that each organ, including oral cavity, is a distinct entity. Each one is interlinked and each one has its own unique functions. And those who think each one is distinct, then they're not understanding the complex nature and the unanimous nature of the human body as such. The excretion of carbon dioxide, pH buffers. So which one do you think is more appropriate answer? Filtering blood by spleen. Spleen is considered as graveyard for RBCs. It has other functions as well in defense, immunity, etc. But it's commonly considered as graveyard for RBCs. Even spleen, even platelets are destroyed. So, in fact, in extremely rare cases, my physician suggested splenectomy too as one of the options for my mother since she had ITP. She has ITP, idiopathic thrombocytopenic purpura. So once you come across such cases in your own family, they'll have more lasting impact on your mind, and you'll be more curious to know about them in an attempt to find out solution. So which are the following? So as majority of you have rightly chosen, yes. Filtering blood by spleen has nothing to do with acid-base balance. So option D is right answer. So rest of the options. So there are three mechanisms that the body uses to control the blood's acid-base balance, and the pH of blood. I mentioned it as well. So number one, excess acid is secreted by kidneys as hydrogen ion, ammonium ion, or combined with phosphate. Number two, body uses pH buffers in blood to guard against sudden changes in acidity. Major blood buffers are bicarbonate, hemoglobin, and albumin. And number three, an excretion of carbon dioxide through lungs in the form of respiration. So blood carries carbon dioxide to lungs where it is exhaled. Respiratory control centers in brain regulate the amount of carbon dioxide that is exhaled by controlling the speed and depth of breathing, right? Kussmaul's breathing, compensatory mechanism. So this shows that higher centers in brain control the rate of respiration to maintain acid-base balance in body. So as majority of you have, yeah, rightly chosen, option D is more appropriate answer. Yes, Danish says even at 720p the quality is not good. It means there is some issue with streaming. Just give me one moment. Yeah, the quality of stream is low, maybe because of poor internet connection in this particular area. Yeah, but don't worry. Okay, as I said, we'll yes, yes. Now it seems to be streaming fine. Yeah, there could be variations in internet speed. Should we wait? Yeah, the video quality is very poor. Luckily, we covered image-based question previously. So it seems to be streaming at a very low quality. I mean, do you want me to wait? Maybe if we can wait for a few moments, maybe we can expect improvement in quality. I think it is better now comparatively. So, anyways, we'll move on to the next question. Since we covered up image-based question, I don't think there is any issue because, we will read out the question for you. So, final question. So, I don't think you need uh, the question as such because the moment I read out the question, you'll give me the answer. So, personal protective equipment (PPE), clinical jacket. So, PPE jacket should be. In fact, this is one of the questions we already covered in study club. So, for YouTube subscribers, let's see. Option A: short sleeve and high neck, long sleeve and high neck. Option C: long sleeve and turtleneck. Howard, Big Bang Theory. Option D: your choice. I mean, you're the stylist. So, which one do you think? Yeah, which one do you think is more appropriate answer? Yes, it is streaming fine now. Yeah, do you want me to go to the previous question? Anyone? So, anyways, since we got the clarity back, so this was the previous question, right? About the mechanisms that maintain acid-base balance in body, and option D was the one which I think majority of you have already chosen. So, final question. So, this is our final question. Personal protective equipment clinic jacket should be short sleeve high neck, long sleeve high neck, long sleeve turtleneck. Your choice because you're the boss. So, which one do you think is more appropriate answer? You don't like turtleneck. You want to go with high neck. Okay, very good, Danish. Yeah, option D is right answer. I'm sorry. Option B is right answer. Option D is also right answer because your choice is option B. So, that's a kind of loop. Option D is also right answer because your choice is option B. But anyways, option B is right answer. Good. So we can observe the illustration here. Yes, for optimal protection. So you need to cover as much as possible to prevent contact and exposure with patient's saliva, blood, aerosols, or whatnot, infectious particles or materials. So for optimal protection, clinical jackets or coats are required to be long sleeved, high necked, as you can see. This equipment was developed to minimize potential for exposed skin to contact and therefore become contaminated with patient's blood, saliva, or other potential infectious material. So, what about aprons? I mean, the aprons which we wore in our entire undergraduation and even in our post graduation, we had long sleeves at least, but they're all short necked, not even high neck. So, does it mean we have been doing it wrong? So maybe this pandemic has taught us one of the important things, especially for a clinician, those who are in medical profession, cover yourself and save yourself. Yeah, yes. Very good. So option B is right answer. So those are chosen. Option B, award yourself plus 4. So please post your scores. So let me know what your scores are out of 20. The first question, those who have chosen only one of the options, please award yourself only 1 mark. If you had chosen all, Kritika, I reckon, so you can award yourself +4 in that case. Yes, very good. So these are some of the topics which I wanted to highlight. And before I review scores, as I keep on reminding, see, initially I mentioned about waking up early in the morning is no solution to all problems, but it's definitely a best starting point. Always keep that in mind. See, we all have a choice, and to wake up early in the morning, one should have a driving force. I mean, what's your driving force? If you have the driving force, obviously you will start waking up early in the morning and utilize additional 3 to 4 of quality hours towards preparation. The counseling is over. All India counseling is almost over. State counselings are happening throughout the country. The exam date has already been announced. So you should have all these things in mind. You know, to start motivating yourself. If none of these are happening, like in last month or so, there was so much of ambiguity, then I can understand. But now, since there is more and more clarity, right? Uh, those should be your motivating factors. I mean, not factors that create fear or panic, but motivational factors, driving force, rather, I can say. So keep those things in mind and use them as a driving force. See, ultimately, whether you motivate yourself or not, whether someone motivates you or not, whether you feel demotivated, depressed, all these things don't matter. Ultimately, what matters is your actions. Ultimately, right? So, in order to act, what are the factors that we need to enforce that action? Good thoughts, positive thoughts, waking up early, motivational quotes, or live sessions. In fact, one of the reasons why we have been conducting these live sessions is because majority of you have said that these are helping you stay motivated. So find out a reason to get things done. That's it. I mean, it can be any kind of reason. Find out reasons to get things done. Because ultimately, in fact, one of my seniors said, and even though I hated it at that time, I really connected with that quote. He said to me when I was in common room during my undergraduation preparation, he said, Naveen, how is your preparation going? I said, sir, it's very tough. I'm trying to give my best. And then he said, just keep this in mind, Naveen. Reasons don't matter, only results do. He said that because he couldn't crack entrance and he was into PG through management quota. He had suffered and gone through a lot of pain. I've seen him personally. He was my super senior, and getting those words from him really meant something. And I repeat, he said, and I still remember his name, by the way, public health dentist, which is one of my favorite professions. So he said, Naveen, at the end of the day, reasons don't matter, only results do. So just ask yourself this question: what matters? I mean, we don't uh, fulfill our dreams or goals. We just can't keep citing reasons. I mean, what good does it do? I mean, if we're trying to justify for others, please don't do that. Not necessary. No one really bothers about us. In fact, it's our life, so we should take care of it. That's not called being selfish. That's being called smart. So you need to take care of yourself. Yes, your parents will support you, but only to a particular extent, not throughout your lifetime. So we can't expect someone to keep pushing us all the time. So just ask yourself this question: what matters to you, reasons or results? It's a harsh reality because ultimately it's results which do matter. And how do you get the results? Through consistent performance. How do you get the result? Through your hard work. How do you get the results? When you start believing in yourself. So rather than being result oriented, this is the irony part here. To get best results, you should not be result oriented. You should be process oriented. Isn't that the irony? You want the best result, you want the result to be good, but you should not be result oriented, because if you're result oriented, unfortunately a conscious mind takes all negative routes possible in the form of stress, anxiety, panic, etc. But if you are process oriented, things are going to change drastically. So in order to get best results, please keep in mind you should be process oriented but not result oriented. I hope you got my point, right? So I really hope you guys are all doing good. Uh, some of you have been mailing me about falling sick, about not feeling well because of SARS-CoV-2, COVID. I'm really sorry for you guys. I'll get back to you through mail as soon as possible. Those who have mailed for assistance or guidance, but as I said, yeah, please don't give up. Situations might appear challenging, but it's all an illusion. I'm telling you. All the stress, all the anxiety, it's one form of illusion because there is nothing actually like stress out there. I mean, can you show that in a physical form? Stress, anxiety, these are human made. These are made right here. Attend one of the 5 clubs. You'll know more about conscious and subconscious mind. Once you start digging deeper, once you start understanding yourself much better, you'll know that these are different forms of illusion. And once you realize the fact, and once you are able to break through those chains of illusion, only then you'll be able to see the reality. And the reality is life is beautiful, life is amazing. It's our thought process which often makes it complicated. Yeah. So, with this, let me conclude. And if you leave me like this, I'm going to talk and talk. Anyways, I really appreciate your active participation. So just keep this consistency and momentum going. And please keep the inputs which I mentioned at the beginning of the session in mind before you attend any of the live sessions. And for any further queries or assistance, feel free to get back through mail 24/7. So wish you all the best. Love you all. I'm going to see you tomorrow morning in 5 a.m. club. Right? Yeah, take care. Yes, yes, Arshi, you're preparing for Ori. That's good. I can understand, Arshi, that you have your own challenges, but yes, you'll definitely have my guidance. Please get back through mail at proudtobedentist@gmail.com. We'll discuss the plan of action. Don't worry, you will definitely come out of it. I know it's very frustrating uh, when exams are not conducted, when they are postponed, even counseling. NEET MDS aspirants have been going through these phases. I can really understand and correlate. Do get back through mail, right? Okay, coming to scores, yeah, Danish, very good. Priyanka, Krishna, Deepanjan, Smriti, Swadina, Kritika, Saurabh, Sujay, Vinita. Yeah, that's good. Only Kritika secured 20 on 20. Yeah, Kritika was smart enough to choose all the options in first question. Very good, Kritika, and very good, everyone. So just keep this enthusiasm and momentum going. Arshi, please get back through mail. We'll discuss. Yeah, take care.